afternoon, everyone. So we are cluster 9 from UTH, and our case is a case of a 69-year. Our case is a case of a 69-year-old man who's retired, and he complained of severe chest pain while climbing the stairs in his daughter's house. And then in the ambulance, he was administered 300 milligrams of aspirin. Um,
You have in your notes.
yeah, wait, sorry, I'm so sorry. Okay, so we're going first with the subjective data. He complained of severe chest pain while climbing the stairs, which could be an indication of stable angina, which is also a symptom of myocardial infarction. Then his objective data had a blood pressure reading of 160, 160/90, which indicates H2 hypertension, and also isolated systolic hypertension. Then his on auscultation of his lungs, it was observed that there were no papules, which is indicative of the absence of fluid or inflammation of his lungs, which could be then his ECG. He showed ST elevated myocardial infarction in the inferior leads, which indicates acute inferior ST elevated myocardial infarction. Now our question is to find an alternative therapy. Sorry.
Let me continue. Let me continue from there. Okay, from what you said, the the patient had heart attack, and from the case, it can be observed that the patient has hypertension, and it was diagnosed that he has diabetes recently, and it is controlled by diet. Now he also has okay. Now he also has osteoarthritis. And now, our question is that we should recommend a drug therapy. So, while recommending this drug therapy, we should put in consideration of drug interaction with the disease, with the drug, and also with food. Okay, from for the hypertension, he was given nifedipine before, but on being like admitted in the hospital, the nifedipine was stopped. So our suggestion was that you should be given an ACI, which is angiotensin 2 converting enzyme inhibitor. Example, Tamiflu. Why are we giving this drug? Okay, one, nifedipine is actually contraindicated in patient that is showing myocardial infarction symptoms. So now this ACI is suitable that it is cardiovascular safe, and also unlike this is the nifedipine, it prevents CV remodeling, that is heart remodeling, due to episodes of heart attack. Then for
What prevents remodeling?
the ACI that is new.
How?
Okay. Now for due to nifedipine actually causes it inhibits reflux of calcium into the smooth muscle of the heart. Now, yes, it's
ACI causes remodeling.
no, it prevents remodeling.
Prevents remodeling. All right. So how?
Okay, it doesn't actually act on the heart per se. It actually acts on the kidney by its mechanism of action acts on the RAS system. That is renin and yes, angiotensin address system.
Is that what causes remodeling? What is remodeling?
Okay, when there is like constant episode of heart attack, the left ventricle actually
Constant episode of heart attack. What is heart attack? Eh?
heart attack is like it occurs when there is a blockage of blood flow to the heart.
That's heart attack.
No, it leads to heart
Is there anything like heart attack?
myocardial infarction.
Myocardial infarction. It's heart attack.
No,
Yeah,
it's
it leads to that.
Eh? So clarify remodeling because you are using very dangerous term. Remodeling. I want to know how ACI causes remodeling
it prevents
or
remodeling.
prevents. Thank you.
Okay. Um. Um. CCC. CC actually is a it's a vasodilator. So when it increases calcium influx to the heart muscles, so the heart actually dilates. That is
The heart dilates,
the blood vessel
dilates
expands. Yes, to cause
by taking CCBs. The heart dilates.
it's one of the process of controlling the hypertension.
How can CCBs? Which of the CCBs are you talking about? Yes.
Nifedipine,
Help.
CCV, there are two types of there's the di
Louder.
there's the dihydro and then there's the hydroxide. So now dihydropyridine.
Louder.
CCB, there are two types of CCBs. There's the dihydropyridine and then the hydropyridine. Now the dihydropyridine is the
Talk to people here at the back.
amlodipine
Shout, shout.
and the amlodipine and the Peptide, yes. And that one causes reverse tachycardia. It says that since CCB works by vasodilation, when it dilates the blood vessels by inhibiting the L-beta calcium channels from entry, to now reduce the influx of calcium channels, to now reduce muscle contractility. So this muscle contractility will now reduce contractility, and then for the heart to be able to compensate, it will have to increase the heart rate. And then this when the heart is on pumping and it's working like faster than normal, now cause what she's trying to explain, like the swelling.
That's from CCB.
Yeah, that's what she's
What
trying to
of
explain.
ACIs?
Okay,
You
ACI.
said ACIs causes remodeling. That's what me I want to
It
know.
prevents,
It
unlike,
prevents.
yes.
Okay, you said what?
I was trying
CCBs
to
does what?
explain why CCB causes that, like the why CCB causes the myopathy, like the enlargement of the heart, like the reflex tachycardia,
CCB causes enlargement of the heart.
like the reflex tachycardia. She's trying to tell you why.
Reflex tachycardia.
Yeah, no.
That is caused by what?
Dihydro.
By CCBs, the
If
dihydropyrimidines.
somebody is
I mean,
taking, yeah, somebody is diabetic and the person is hypertensive and is taking that drug, it can cause that, like the nifedipine causes that.
how?
Trying to say that nifedipine is a vasodilator. So when it's
Vasodilator, is it on the heart?
the most the vessels,
Which vessels?
the vessels lead to the heart, so it's those
Coronary vessels.
pulmonary vessels. So it's to dilate the vessels,
So if you dilate the vessels,
it's to open the vessels and decrease the blood pressure, but increase the blood volume.
Increase the blood pressure.
It will decrease the blood pressure, but it will increase the blood volume. That's how it helps to take care of hypertension. Because person doesn't have
what is the primary function of CCBs, the calcium channel blockers?
it's just to block the calcium channel. That's to
So if
treat
it blocks
hypertension.
calcium channel, what does it? What happens?
It will dilate.
It is not true. I don't believe it.
Did you read round it?
That,
Did you read round it? Did you read round it?
yes,
You read.
yes.
It didn't tie the knot. What's the basic for muscular contraction?
Influx of calcium.
Okay. Okay.
Eh?
So and when the muscle contract, what happened? Huh? What happened?
Pumping of blood.
Pumping of blood.
Pumping of blood.
It looks
Okay.
like you people are a bit confused.
I need a
A
pumping.
stage problem. Stage fright has made all the memory to take a flight. You see, that's the problem.
But that's what I read actually. That
You have not convinced us how it. You can't just come here and tell us it causes something. We are scientists first, before we are any other thing. Before we are pharmacists, we are scientists. That's why you go to Faculty of Science in year one to get appropriate science before it now come and land on top of pharmacy. Pharmacy is a science course first before a professional course. So if you say something is causing something, You cannot say it vaguely. ACI causes prevents remodeling. And now say how? How now? You have not, you tell me how now. Yeah, you tell me how. It's an information, is it not so?
Yes, sir.
You can give that to a layman and he will take because you will intimidate the layman. I am a pharmacist. But if you are talking to us, your colleague scientists, they will ask you why, how. So you must be able to tie the molecular knots. Do you have any knots, any bridge there that you want to tell us? There is any bridge in your thoughts between ACIs and remodeling of the heart? Is there any bridge? Any bridge? No bridge. All right. Time out.